Well, it's called Election Readiness Day, and it was held today in Ottawa. It's not a boot camp for future politicians. It's a preparation session for Canada's doctors in anticipation of this fall's federal election. Before each election, the organization representing the country's physicians, the Canadian Medical Association, meets in Ottawa to brainstorm and decide on the key issues it wants doctors across the country to put to their potential MPs. Joining me now is Dr. Gigi Osler. She is president of the Canadian Medical Association. Thanks for coming in.
Thanks for having me on.
All right, after this session, what would you say is, if you have to choose on one key message and one key issue that you want physicians and those who are close to them putting to potential MPs, what would it be?
I think if you talked to any Canadian and asked them what they thought was the top issue on their mind, health is almost always the one issue that they have concerns, either their own health or they may have aging parents. And so I think if there was one issue we would want Canadians talking about, it would be about health. And how do we get health back on the agenda?
So just to get the whole idea of health into the mainstream?
I think so. I think we need to have a discussion about the healthcare system, how it's functioning, because we see so many of the challenges associated with the healthcare system right now.
So why would it not be, if it's forefront of people's minds and concerns and preoccupations, why would it not come up in discussions with your potential MP?
That's a good question. And you know, when you think about health, it has moved beyond being a social issue. It's moved beyond just being a policy issue. It's a pocketbook issue for Canadians, because we're seeing Canadians pay more and more out of their own pockets for things like long-term care, home care, prescription medications. And so I think it is one of those issues that, as it's affecting Canadians more and more, we need to have some serious discussions.
So then that brings up one issue, and in terms of specifics, pharmacare. You know that the NDP has promised universal, single-payer pharmacare across the board. The Liberals are waiting on a report by Dr. Eric Hoskins. He's going to give his final report, and the Liberals are promising some form of pharmacare, which they say they will bring in if re-elected, but it might be a backstop. It would be partial. It might be means-tested. It might be... What is your position? What are you telling doctors to tell or to ask about when it comes to pharmacare?
So pharmacare is an important part of one of the things that's not included in our what's covered under our current healthcare system, for example. And so I think it is going to be a lot of details in the report that we are going to have to look at. So is it going to truly be universal? Is it going to be a fill-in-the-gaps approach? You would like it to be income tested, so those Canadians who are low income or no income or seniors on fixed income really can benefit from it. But I think when you look at the bigger issue of healthcare and what's not included, what do we have to pay for out of pocket? I think seniors care is a huge issue. You know, we've got just under 20% of our Canadians who are 65 and older, and yet that age group needs 50% of our healthcare dollars. And that's a demographic, that's a group of Canadians that's only going to get older and need more healthcare dollars.
Is there a concerted effort? Because a lot of this discussion, when we discuss about future MPs, a lot of federal politicians will say, well, you know, health is predominantly a provincial jurisdiction. Is seniors care, for example, is that an area, because we've seen the federal government name a seniors minister now, responsible for developing a senior strategy. Is that an area where your MPs and people should be holding their MPs to account?
And certainly having a seniors minister at the table to advocate for the needs of seniors is important, but it's not the only thing. And if you look at the proportion of Canadians per province that's getting older, there are going to be different provinces that have different challenges based on the number of seniors that they have in that province. So one measure that we've advocated for at the CMA is a demographic top-up to the Canada Health Transfer. So if your province has a high percentage of seniors who are going to be needing more health care and use more health care dollars, then in addition to your health transfer, you get a top-up to help the provinces cover the costs of their aging seniors.
Which brings up another topic. You've just come from a debate put on by the Economic Club of Canada, and you were part of one of the debaters on that, and it was revisiting the Canada Health Act. Every election, there is a discussion about it being inviable, invaluable, but should we reopen, or the discussion about whether we should reopen the Canada Health Act. The CMA, Canadian Medical Association, is one of your points, I don't know, modernization, like this seniors top-up. What else would you do? Why should we be having a debate about the Canada Health Act?
So we as the CMA don't have a position on whether or not to revisit the Health Act. But we do think it is time to have a very serious, frank and open discussion about, is it time to modernize it? You know, it's an act of legislation passed in 1984. Healthcare needs in 1984 were different. And the origins of the Healthcare Act go back decades. And really the origins of Medicare started when we had a younger population that was healthier and focused on acute care. Now, Canadians are getting older. We're living longer with more complex health needs. And so an act that was passed in 1984 isn't meeting our healthcare needs now.
But as you know, because you're the president of the CMA, a previous head of the CMA waded into these waters. He was in favor of at least talking about privatization or more privatization. As you know, it's a profoundly political issue. The CMA or yourself, when you talk about modernizing, because a lot of people also, when they hear modernizing, the alarm bells go off. They say, are we talking about privatization? Are we talking about more private provision of services? Are there, you mentioned the seniors top-up, are there other punctual, important things that you can suggest without an opening the gates to privatization?
And that was discussed today, and I think that is one of the multiple ways we could improve the governance and delivery of healthcare. So maybe it is modernizing the Healthcare Act, but modernizing it doesn't necessarily add complexity and add other payment systems. You can modernize it without necessarily entering into that debate. There are other mechanisms, the healthcare accords, demographic top-ups. So there are other mechanisms to look at the healthcare needs of Canadians now that simply haven't been talked about at high levels. And so part of the reason we're having this conversation is because we want every Canadian to think about healthcare as an issue. And we want every Canadian to be asking their candidates, what's your plan to make the healthcare system better? Because this is a nonpartisan issue. Healthcare affects all of us.
I think that's a good point to end on. We'll see how effective you are in giving that boot camp to all of the MPs across the country. Thank you very much for coming in.
Thanks for having me on.